what kind of car accident was this?
I was rear-ended and pretty much caused me to jerk forward violently. My vehicle lifted and actually did a full 180. And ever since then, it's back pain, especially when I'm laying on uneven surfaces.
Okay.
Or any sudden jerking motions or occurring.
Okay. And how far long ago was this accident?
This was about 4 years ago. So
4 years ago. Okay.
So randomly, I do feel pain. Especially my job. I do a lot of blue collar work. So there's a lot of heavy lifting involved. A lot of times I'm required to bend over and lift things up. Sometimes squatting isn't an option.
Yeah. So sometimes we have to use our entire body, right? And even at that, even if we try to do the best practices of keeping the correct posture, it's still yank us a little bit.
That's right.
Okay. And so immediately after your car crash, what did you go do? Who did you go see?
I went to pretty much just a court-appointed chiropractic clinic.
Okay. Yeah. And what kind of treatment did they do there?
Mostly stretches.
Okay, stretches.
Yeah, some basic mobility exercises.
Interesting. Yeah, so did they have you get on any kind of setup such as similar to this?
Not really.
No.
No, I saw them, but I didn't use it.
Oh, so they had similar tables? Or just a regular standard table like the ones I have over there?
That I can recall, a little more basic looking. Other than that, I was mostly put on like therapy tables.
Okay.
There's a lot of stretching.
Okay.
A little bit of standing work with resistance bands.
Yeah, so pretty much what you're describing to me is just a way a standard clinic is set up. They're not really necessarily equipped to handle complex cases when it comes to car accidents or any traumatic injuries, and that's what we do differently here. We really focus on doing it is a core chiropractic technique. It is called spinal decompression. The table makes it so that the patient's muscles are not actively guarding and creating any counter effects to the motions and to the positions that we put them in. So today we're going to demonstrate a protocol that we implement here, especially for our car accident injuries. Since this is your second treatment, we're pretty much going to be doing the same thing as we did last time, right? We're just going to gauge your ranges and really just take you through all the natural ranges of motions and see where you can go, see where you can tolerate. Can you hold this for me right here? So this is just going to really keep your pelvis in place. Because as a table, as a distraction, this is going to pretty much latch at your hip bones and pretty much lock in right there. Just lay down on your back. And now I'm going to be putting another latch on you, and this is just really just to stabilize the pelvis. Make sure you don't fly anywhere, okay? Alright. You let me know if it's too tight, okay? You can go ahead and lift your legs. So because you don't have a acute flare-up, you're able to lift your legs with pretty much with ease. But sometimes we do have patients that have a difficult time just climbing on top of the table as it is. So it is important that we really just take the time to understand how we're going to position a patient in the first place. Makes you nice. Okay, and how's it feeling on you?
Good. Snug. Comfortable.
Nice. Into your ankles. pretty much similar to last time. We're going to start here at straight axial decompression, and then we're going to go left and right to really just test your different ranges. Okay. So again, we're just finding your tolerance. So I already have a baseline for you, so we're going to start there, and you're going to tell me. You need to be very vocal with how you feel, okay? Because it's going to take our time. How are we right? So how's this? Again, I'm not trying to recreate the pain, I just want to reach the moment where you feel just a slight pull.
There's a slight pulling, it doesn't quite hurt yet, but it feels like it's getting.
Okay.
It's tolerable.
Yeah, because I don't want to push the boundary, I just want to reach the boundary. Because this is a gradual progression. We're at about 3 inches, so now I'm just getting used to that, and then we're gonna start going left to right. So essentially, this is what we want to be continuously doing. We just want to slowly engage the spinal column into creating these little micro stretches, and during this entire process, it is creating millimeters of space within the joint spaces, and this allows for nutrients and everything to flow in and really just begin to circulate within the region. So now we're going to start going side to side. Okay, so we're gonna go ahead and start on this side. I want you to tell me the exact moment you start feeling the pull, okay?
Right there, I definitely feel a stretch.
Okay, so that's where we're stopping. So you see, that's just about 1/4 of the distance that the table can actually go, because it can go pretty far. And again, this distance is different for everybody, right? So this is where you're gonna start at. And again, I'm gonna start distracting it, and I want you to tell me exactly when you start feeling the pull, okay?
That's okay.
Okay. So it's about 2 inches.
Absolutely.
Yeah, so essentially what we're doing is just relieving the pressure in your lumbar spine. So it's really just elongating all of the musculature and the ligamentous structures within the lower half of your skeleton. So again, it's just inducing micromillimeters of space within the different segments, right? And essentially that is our goal here, because more space means more movement, right? And more movement means less restriction. And what happens when we have less restriction? We have more capabilities as far as our natural range goes. We move better, we feel better. And essentially that is our goal here, right? How long were you seeing the other clinic immediately after your accident?
As the accident was over, probably within 2 or 3 days.
Mm-hmm.
And after that, I was going about 2 or 3 times a week.
Okay. For a little over a month, 2 months. And that's the thing, everyone. Immediately after an accident, you need to be very selective of the practice that you go visit, because sometimes they are simply not equipped to handle these kind of cases. So that's why it is very important to look for a second opinion, talk to your attorney, talk to another clinician. Okay, so now we're going to the other side. So you tell me exactly how far I can go, okay? Tell me when.
Keep going. It's tolerable. Still good.
Still good?
Probably right there, so it starts becoming really uncomfortable.
There. So you can't see this, but you see on this side, you're not able to go that much, but on this side, you're actually able to go at least more than 3/4 of the way. So this is your range on this side. Okay, we're going to repeat the process. You tell me exactly when. Okay, how are we right here?
Right there. It starts to feel pain. It's pretty relaxing.
So now we're going position. Okay, how are we feeling?
So good.
Okay.
Range of motion feels a lot better.
Oh yeah, you feel it, huh?
Yeah.
Yeah, so I'm actually able to go past 3 inches right now, so. And also I'm also inducing the distraction and slight flexion this time, so. Previously we're doing it in extension, now we're doing it in flexion.